Well, President Trump has long been dismissive of the coronavirus and the precautions his own experts have recommended. Here's how he has reacted to the greatest public health challenge in decades.
From initial optimism in February,
looks like by April, in theory, when it gets a little warmer, it miraculously goes away. I hope that's true.
To an abrupt about-face in March.
Today, I am officially declaring a national emergency.
U.S. President Donald Trump has gone to extremes in his public attitude toward the coronavirus. He's always sought a silver lining, even as the death toll skyrocketed.
America will again and soon be open for business. Very soon. We cannot let the cure be worse than the problem itself. We're not going to let the cure be worse than the problem. You're going to start seeing some real light at the end of the tunnel, but this is going to be a very painful, very painful 2 weeks.
Trump soon turned a medical problem into a political issue, forcing the public to choose between him and the experts. When government scientists recommended wearing masks, he scoffed at the idea.
I just don't want to wear one myself. It's a recommendation. They recommend it. I don't know. Somehow, I don't see it for myself. Maybe I'll change my mind.
He didn't change his mind, but as the pandemic refused to go away miraculously, he mused in public about rather unorthodox treatments.
Supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light. Then I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way, right? And then I see the disinfectant where it knocks it out in a minute.
By June, as testing ramped up, along with case numbers, he seemed exasperated.
If you don't test, you don't have any cases. If we stop testing right now, we'd have very few cases, if any.
And he started mocking the virus, making racist jokes and blaming the pandemic on China.
It's a disease, without question, has more names than any disease in history. I can name Kung Flu. I can name 19 different versions of names.
With the election looming, he doubled down on mocking masks, even during the presidential debate.
I don't wear masks like him. Every time you see him, he's got a mask. He could be speaking 200 feet away from it. He shows up with the biggest mask I've ever seen.
That attitude held up until the last minute. At this rally in Minnesota on Wednesday, Trump threw souvenirs barehanded into a packed audience, where few wore masks. It remains to be seen how seriously Trump's diehard supporters will now take the virus that has put their hero into quarantine.
Well, let's get the scientific perspective on this. Eli Rosenberg, Associate Professor at Epidemiology and Biostatistics at the University of Albany. Welcome. What was your reaction when you heard about the President's diagnosis?
Well, I'll admit I was shocked, but I wasn't surprised. As you just played a montage of, the President has disregarded the advice of his own public health agencies and experts, particularly around mask wearing. And so it's not terribly surprising that he might become infected, given how frequently, how busy his schedule is, to how much of the public he interacts with.
Eli, we're talking about a medically obese 74-year-old who's in a stressful job. What does this disease do to people who fit this physical and situational profile?
Well, yeah. So, I mean, since the early days, there's been mounting evidence that both weight and age, particularly being over 65, 70, are really both risk factors for developing severe outcomes, severe COVID-19 disease, and ultimately, requiring hospitalization and we know that levels of mortality are higher as well for people in those groups. So there are risk factors for sure. Obviously, we need to see what will happen in the coming days.
He's been on the campaign trail. Tracing the President's contacts over the last few days is going to be a big job. How far do they need to go back into that file?
Well, that's a great question. So I think, for better or worse, the president is one of the most watched people in the world. And I think, in order to attend his events, people have to go through security, register, and so forth. So I think developing lists and following up with people will be a possible task. It's going to be something that's doable. And I think we know there are lots of contact tracers in states and counties that can provide assistance to this. So I think it's a possible task, but it will obviously, right, will go back some days and requires contacting, reaching out to quite a large number of people. But I think it's a doable task.
What does the Trump diagnosis teach us and teach the American people, if anything, about how best to deal with COVID-19?
That's a great question. Well, I think there's several pieces here. Obviously, it's a very telling and important example and lesson in the value of adhering to science-based protocols for limiting transmission. Maintaining distances and wearing masks are important. Sorry, yes?
No, continue.
I also think it's really. Oh yeah, sure. I also think it's an example of really of a bigger problem facing the United States right now. President Trump, in disregarding his experts on COVID-19 and trying to downplay the severity of the virus, right, has had real implications on our country as a whole. And so I hope that an outcome of this episode is that President Trump will learn from his personal experiences and use the time in office to take more aggressive pandemic response in this country and realize it's not going away and that we really need a coordinated national response.
Eli Rosenberg, thank you so much.
Thank you.